Hello everyone, welcome to RPIIT Medical Campus. This is Dr. Priyanka Chauhan, working as an assistant professor in physiotherapy department. Today we will discuss about cervical vertebrae. In our body, the spinal cord is surrounded by the vertebral column, which is made up of the small vertebrae. The vertebral column consists of the 5 regions: cervical, thoracic, lumbar, sacrum, and coccygeal region. The vertebrae present in the cervical region just below the skull in the neck are known as a cervical vertebrae, which are total 7 in number. These are C1, C2, C3, C4, C5, C6, C7. The C3, C4, C5 and C6 vertebrae are classified as a typical vertebrae, which share the similar features. Now, the vertebrae C1 is known as the atlas and C2 is known as the axis, which are classified as a atypical vertebrae. Similar, C7 is also classified as a atypical vertebrae, which have the different features. Now, we have one important feature which help us to differentiate the cervical vertebrae from the other vertebrae present in other region. The important feature is transverse foramen. All cervical vertebrae have the transverse foramen. Now, in this video, we will discuss about the features of the typical vertebrae and look at the features of the atypical vertebrae in other video. Now, see, this is body which is oval in shape and small in size. This is vertebral foramen, which is triangular in shape and larger than the body. This is transverse process, which have an anterior and posterior tubercle, and this is transverse foramen. Now, this is spinous process, which is bifid in nature. And we have a pair of pedicles, which are directed backward and laterally. This is lamina. Now, at the junction of pedicle and lamina, we have superior articular and inferior articular process. These are the superior articular process, and if we see in the oblique view, just below the superior articular process, we have an inferior articular process. The superior articular process is directed backward and upward, and inferior articular process are directed downward and forward, and these both processes form the articular pillar. I hope this video will be helpful for you. Thank you. Please like the video and subscribe the channel, that is RPIIT Academics.